Have you heard the news? A new flu strain, H3N2, is making headlines, especially with cases surging in the UK. But what exactly is it, and how worried should you be? Today, we're breaking it all down. What H3N2 is, how serious it can be, the key symptoms to watch for, and most importantly, what you can do to protect yourself and your loved ones. Let's get straight into it. First things first, what is H3N2? It's not a brand new virus. H3N2 is a subtype of influenza A, which is one of the main types of flu viruses that circulate among humans every year. H3N2 has been around for decades, first identified in humans in 1968. So why is it getting so much attention now? They undergo small genetic changes, a process called antigenic drift. This means the version of H3N2 circulating this year might be slightly different from the one your body encountered a few years ago. Sometimes, H3N2 seasons can be more severe than others. Historically, seasons dominated by H3N2 have often been linked with higher rates of hospitalizations and, unfortunately, more deaths, particularly among vulnerable groups. This includes older adults, young children, pregnant women, and people with chronic health conditions like asthma, diabetes, or heart disease. Why is that? One reason is that H3N2 tends to drift more rapidly than other flu strains, making it harder for our immune systems to recognize and fight it off, and more challenging for vaccines to provide a perfect match. So, this brings us to the big question. How serious is the current situation? Public health officials are seeing a significant rise in flu cases, and H3N2 appears to be the dominant strain in many areas. This surge is happening alongside other respiratory viruses, putting a real strain on healthcare systems. This triple-demic of flu, COVID-19, and RSV is why you're hearing so much about it. It's not necessarily that this year's H3N2 is inherently more dangerous than past versions, but the sheer number of people getting sick at once is a major concern. Now, let's talk about what you need to look out for. The symptoms of H3N2 flu are very similar to other flu strains. They usually come on suddenly and can feel quite intense. The most common signs include a high fever, a dry cough, a sore throat, and a headache. Extreme fatigue and weakness are also very common. You might feel wiped out for days. Other symptoms can include a runny or stuffy nose, chills, and sometimes, especially in children, gastrointestinal issues like nausea, vomiting, or diarrhea. Generally, the flu hits you much harder and faster than a common cold. With a cold, you might feel a bit under the weather for a day or two before it really kicks in, and symptoms are usually milder, like a stuffy nose and sneezing. The flu, on the other hand, tends to knock you off your feet abruptly with high fever and body aches. Comparing flu to COVID-19 is even more challenging. Early on, a loss of taste or smell was a hallmark of COVID, but with newer variants, this is less common. Both can cause fever, cough, and fatigue. The only way to know for sure what you have is to get tested. If you're feeling unwell, especially if you're in a high-risk group, it's a good idea to contact your doctor. They can advise you on testing and treatment options. Speaking of treatment, what should you do if you get the flu? For most healthy people, the flu is a self-limiting illness, meaning it will go away on its own. The best thing you can do is rest, rest, and more rest. Your body needs energy to fight the virus. Stay hydrated by drinking plenty of water, broth, or electrolyte drinks. Over-the-counter medications can help manage your symptoms. Pain relievers like paracetamol or ibuprofen can help with fever, headaches, and muscle aches. Decongestants can help with a stuffy nose, and cough syrups can soothe a sore throat. Always read the label and follow the instructions. And if you have any pre-existing health conditions or are taking other medications, check with your pharmacist or doctor first. For people who are at higher risk of complications, a doctor might prescribe antiviral medications. These drugs, like oseltamivir, work best when started within the first 48 hours of symptoms. They don't cure the flu instantly, but they can make the illness milder, shorten its duration, and most importantly, reduce the risk of serious complications like pneumonia. So, if you're in a high-risk category and you think you have the flu, don't wait. Seek medical advice quickly. Now, let's focus on the most important part, prevention. The best defense is a good offense. First and foremost is the flu vaccine. Getting your annual flu shot is the single most effective way to protect yourself from the flu. It helps your body build antibodies against the most likely circulating strains. While it's not a 100% guarantee you won't get sick, it significantly reduces your risk of catching the flu. And if you do get sick, being vaccinated makes it much more likely that your illness will be milder, and you'll be less likely to end up in the hospital. It's not too late to get vaccinated. It takes about 2 weeks for the vaccine to become fully effective, so the sooner, the better. Beyond the vaccine, good old-fashioned hygiene is your best friend. Wash your hands frequently and thoroughly with soap and water for at least 20 seconds. If soap and water aren't available, use an alcohol-based hand sanitizer with at least 60% alcohol. Try to avoid touching your eyes, nose, and mouth, as this is how viruses enter your body. If you are sick, please stay home. This is crucial for preventing the spread to others. Cover your mouth and nose with a tissue when you cough or sneeze, and then throw the tissue away immediately and wash your hands. If you don't have a tissue, cough or sneeze into your elbow, not your hands. It's also a good idea to regularly clean and disinfect frequently touched surfaces in your home, like doorknobs, light switches, and remote controls. Wearing a mask in crowded indoor spaces can also provide an extra layer of protection, not just from the flu, but from other respiratory viruses as well. We all got very used to this during the pandemic, and it remains a simple and effective tool to reduce transmission. Let's recap the key takeaways. H3N2 is a common strain of influenza A that can sometimes cause more severe flu seasons. Its symptoms are classic flu, sudden fever, cough, body aches, and fatigue. While most people recover at home with rest and fluids, it can be serious for vulnerable groups. The best way to protect yourself is by getting the annual flu vaccine. Practicing good hand hygiene, staying home when sick, and considering wearing a mask in crowded places are also fantastic ways to stay healthy this flu season. If you are struggling with your mental health during this time, whether from illness or the stress of the season, please reach out for help. Talk to a friend, a family member, or a mental health professional. You are not alone, and support is available. We hope this video helped clear up some of the confusion around the H3N2 flu. It's about being informed, not alarmed. By taking these sensible precautions, we can all help protect ourselves and our communities. Stay safe and stay healthy. Thanks for watching, and if you found this information useful, please give this video a thumbs up and consider subscribing for more health and wellness content. See you next time!